one of the things that has been notably increasing over the past year during this pandemic is the problem with addiction, gambling. Now, you don't have to watch TV for long, scroll through social media for long before you see an ad encouraging you to gamble. But sometimes the information in terms of the risks of how addictive gambling can be isn't really put out there. And the fact that some people who engage in it can develop an addiction. Well, my next guest has seen this rise in problem gambling in her work as a cognitive and behavioural therapist and addictional counsellor. It's great to have with us Susan Byrne. Well, first of all, Susan, can you just tell us exactly how do you know that you have a problem with gambling? What are the kind of things to look out for?
Okay, nice to talk to you, Wendy. Well, problem gambling is also referred to as disordered gambling or gambling addiction, but it also comes under the impulsive control disorders. And what that means is that it is both compulsive and impulsive, as all addictions are compulsive, self-rewarding behaviours. And what happens with problem gambling is that our brain becomes stimulated, it looks for more dopamine, and then we have the mood-altering emotional rewards that come with it. And, you know, the three cornerstones of problem gambling, as with all addictions, are that we would say you're in one of three stages. You're either A, actively engaged in the gambling itself, or B, you're preoccupied about when you can next have your another gamble, or C, you're recovering from an episode of gambling. And addiction is a very, very slow process. It's very slow, it's very gradual, and it takes a period of time to develop. So we're not looking at something that develops over, you know, a week or a month or a year.
So does that mean, Dr. Byrne, that for some people it can be a slow boil, isn't it? It's just something that you do recreationally and you don't kind of realise it becoming a problem because it happens slowly over time for most people?
Absolutely, yeah, and that is how addictions creep up. They evolve very gradually, very slowly. And, you know, there are some factors that we need to take into account. So if you have a family history of any addiction, then obviously you're going to be a little bit more predisposed. And then you have, you know, in gambling in particular, you have early exposure to it. You've peer pressure. But what I would see a lot of, Wendy, is where people are self-medicating or they're self-soothing through gambling. And they may be covering up something like depression or anxiety or OCD, and I would see a lot of ADHD, particularly in male gamblers. But some of the signs and symptoms of someone who might be developing a gambling issue would be that they would be withdrawn from their family in particular. There would be a noticeable reduction in their social activities and socialising in general with friends. They seek to become more isolated. They want to spend more time of their own. There would be things like excessive spending, excessive time on a smartphone, not meeting commitments in work or within the family relationships being damaged, personal relationships. And a big one around a gambling addiction is secrecy around finances and money, and, you know, something obvious like hiding bank statements on a computer, that kind of thing. And we need to remember that the nature of addiction are two things. Like the bedrock of any addiction are lies and denial. And denial, when clients, people are in denial, it keeps them in their addiction longer. So it serves a purpose.
Yeah, because you're going in on yourself and you're not accountable to anyone but yourself if you're hiding it. But is there a particular age group or demographic that's more affected by gambling? I'm thinking as well just how much gambling has gone online and how easy it is, you know, to put in your card details or whatever. You can do it on your phone, your computer, so many different places, whereas, you know, 20 years ago you'd have to go into a betting shop.
Yes. Yeah, and it has changed. The demographics have definitely changed, and so has the gender. So I think maybe if we went back, you know, even in the last 10 years, it was male dominated. You were looking at middle-aged groups. That has all changed significantly. I see clients coming into my clinic, and they're younger and younger. I have 2 16-year-olds at the moment with gambling issues, addictions. But I also have several women in their 50s and 60s who have developed gambling issues. And it has become definitely more accessible. As you've said, a couple of years ago you were going into a betting office. Everything now can be done from a laptop, a home computer, but in particular a smartphone.
Yeah, you can be anywhere and you can say, I'll just go on for 5-10 minutes, and there you go. You've got that dopamine hit you were talking about earlier, and spent, or wasted, lost, whatever word you want to put in it, lots of money. What do you say to someone then, Dr. Byrne, for someone who's listening and going, yeah, I'm identifying with some of the things that you're saying, but almost kind of naming it or saying that I might have a problem is the scariest thing to do. What's your advice?
Okay, well, the definition of addiction, Patrick Carnes gives a brilliant definition of addiction. I use this with my clients all the time. It's a repetitive, cyclical process, which is preoccupation, ritualization, acting out, despair, and then we're back into preoccupation. So it's the lovely loop. But what we do know, with the dopamine hit and with changing neural pathways, what we get when we're addicted to anything, whether it's a chemical or a behavioural addiction, is comfort, excitement, escapism is a big one, and confidence. So what I would say is, if you think, you have a problem, and it could be, as I said, Wendy, that you're masking something else. So I would see a lot of mood disorders with addiction. Somebody doesn't present with a gambling addiction on its own. You present with a gambling addiction with anxiety, depression, possibly mood disorder, possibly personality disorder, possibly ADHD. And if somebody out there is listening and they feel that, yes, I'm hitting some of those markers, I think, what I thought was a hobby or something I was doing, to spend a couple of hours, getting some pleasure out of, is now out of control and is escalating. The first thing I would suggest is they talk to someone they trust, even a family member or a friend, go to their GP, maybe book in with an addiction specialist. And I'm saying addiction specialist because you need somebody who's specifically trained in the addictions. Go on to the ACI website, which is the Addiction Counsellors of Ireland, and make an appointment and go and talk to somebody and have that consultation. And Wendy, what I would say also is to people out there is no cure for addictions. Addictions are managed, but they can be managed really well with the right supports and through the appropriate interventions. People can make a really, really good recovery.
Susan, you've given advice there just for an individual who's decided I need to get help. But what about another situation? Let's say you have a spouse who's realised that their spouse they've discovered that they have this addiction, or indeed you mentioned earlier that you've had, teenagers coming in seeking your support. A parent who realises, oh my gosh, I don't know, my credit card's been stolen or something like that. What do you do if it's somebody other than yourself that you realise has a problem, but you want to handle it in the way that's going to best help them?
Open the lines of communication. What I would suggest in that situation is that the spouse or the family member goes and talks to an addiction specialist initially. Have a meeting with them, get the information. We call it psychoeducation. Get as much information as you can. Be educated in what a gambling addiction is, how it presents, what the interventions are, what kind of therapies are available.
Okay, so open the line of communication is a great place to start. Well, thanks so much for your advice this morning. That's Dr. Susan Byrne from the Connolly Counselling Centre.